This video introduces NovaVision Bernell's integrated program specifically designed for professional use by eye care professionals in a practice or rehab center environment. NovaVision's fundamental concept is to provide evidence-based therapies that have been developed to target specific visual disorders resulting from a stroke or other brain injury, and are therefore very different from other general programs. The therapies are patent protected and supported by decades of scientific research and clinical studies and papers. NovaVision Bernell's Optometrist Pro model offers programs for the diagnosis and rehabilitation of visual defects as a result of stroke or other brain injury. NeuroEyeCoach is an evidence-based, dedicated visual training program specifically designed to improve scanning and eye movement efficiency in patients. Research has shown that specific computer-based saccadic training is more effective than non-specific visual training apps or programs incorporated into a rehabilitation suite. The diagnostic program is called Vision Diagnostic Test. It enables eye care professionals to perform high-resolution, 7-minute visual field tests to screen for central visual field deficits. NeuroEyeCoach is different to any other saccadic therapies on the market and provides eye care professionals with a unique program designed to improve patient care and outcomes. Occupational therapists, optometrists, and other eye care professionals have historically relied on a range of devices originally designed to address other problems, which are therefore, by definition, suboptimal for the rehabilitation of neurologically induced vision loss. NeuroEyeCoach was specifically developed to help improve scanning and eye movement efficiency in patients with neurologically induced visual disorders and is supported and validated by extensive clinical data. The images on the screen represent the positive outcome that patients can have after completing NeuroEyeCoach. In the image on the left, before the patient performed NeuroEyeCoach, they had smaller eye shifts, many fixations, and therefore their scanning time was much longer. After completing NeuroEyeCoach, their eye shifts were larger and required less fixations, and their overall scanning time improved. The program is personalized and self-adaptive by systematic adjustments of the time allowed for the visual search to reach predefined levels of accuracy. NeuroEyeCoach has 12 levels of increasing difficulty, with 3 stages per level, each lasting about 15 minutes. The task difficulty varies from pop-out to more complex searches and finally conjunction searches by manipulating distractor numbers and distractor target similarity. The entire program can be completed in 2 to 4 weeks, and patients have the ability to start the program in the clinic and complete it at home. The program is intuitive, with the patient following simple on-screen instructions. It is set up automatically for the patient using a font size test and adapts to the patient's progress. Eye care professionals therefore require minimal training to use the program, but once familiarity is gained, parameter adjustments can be made if desired. NeuroEyeCoach was created drawing on a large body of clinical evidence from 13 studies with a total of 551 patients, the findings of which were distilled into the first standardized protocol for the clinical management of patients using compensatory techniques. In 2016, the therapy was validated by a 3-center peer-reviewed clinical study published in Biomed Research International. The study concluded that NeuroEyeCoach is the first evidence-based, vision-specific, clinical gold standard, registered medical device accessible to patients at home or in clinical settings. The study generated a lot of interest with both the popular, business, and medical press. It is increasingly being recognized that vision disorders in stroke and brain injury patients can have a significant impact on their ability to respond to other rehabilitation modalities, as well as affecting their quality of daily life, as up to 1/3 of stroke and brain injury patients could have a vision disorder. NovaVision wanted to develop a simple diagnostic test to enable eye care professionals and therapists to identify quickly and effectively whether patients have such a disorder without having to tie up other expensive equipment, or if the patient is in a rehab center, perform the test on site without having to send them out of clinic for specialized testing. NovaVision designed the test to be completed in less than 10 minutes. The VIDIT program is intuitive, provides step-by-step on-screen instructions, and is preset with default parameters for a short 7-minute test. As a result, minimal training is required to enable an eye care professional to perform the test. All parameters are adjustable, however, so as the eye care professional's understanding of the program increases, so a wider range of tests to adapt to the patient requirements can be performed, as well as highly detailed assessments of a visual field by changing the number of stimuli presented and the size of the grid. This parameter adaptation enables testing of patients with visual and/or cognitive impairments who might have greater difficulty with standard perimetry. Several tests can be performed so that the visual field test results can be overlaid to obtain a multi-test baseline and to assess improvement during rehabilitation. By looking at the grid, an eye care professional can easily and quickly identify whether the patient has a visual field deficit, and if so, its location. The program also provides detailed written results that cover stimuli accuracy, fixation point accuracy, patient errors, and patient response time. A practice with the optometrist model will be distinguished as having a specialized visual rehabilitation program which will improve both its standard of care and the quality of life for its patients who have experienced stroke or brain injury. That concludes a presentation on NovaVision Bernell's optometrist model. I now want to take a few minutes to let you know that NovaVision additionally has a vision restoration therapy. NovaVision's objective is to provide for patients a complete regimen of vision rehabilitation covering diagnosis and initial training and compensation in the practice or clinic to continued vision compensation and vision restoration at home. We have already shown how NeuroEyeCoach can be started by the patient in the practice or clinic and continued at home, with both remote or periodic face-to-face review and monitoring by the eye care professional. NovaVision's VRT is a home-based, FDA-cleared, evidence-based restoration therapy which complements NeuroEyeCoach. The program is a 6-month therapy and so is done at home, handled by NovaVision's clinicians, and provides an excellent next stage of visual rehabilitation for your patients once they have completed NeuroEyeCoach.